Hey guys, Dr. Jeff Chiropractor in New York City, and we're going to do some active release on Simona. She has some neck pain and tightness in some of the muscles. And a lot of people ask, what's the difference between active release technique and other techniques? The difference is active release technique has specific maneuvers to get into different muscles. How's that right there?
So nice.
And what we're doing is getting into some of the muscles in the front. We could also get into some of the muscles on the side of the neck right there. And we're also going to get into muscles that attach into the back of the skull. How's that one right there?
It feels amazing.
Good. We're also going to get into a muscle that causes headaches. Okay? You have one right over here. We're going to contact it. Take my fingertip, put it behind there, and just pull that through right there. I know you feel that one right there. Good. And then we're going to get on its sister muscle right over here. I'm going to take my fingertip, put it underneath there, bring this muscle through right there. How's that one right there?
Feel it?
Good.
Much better.
Right there.
Yeah.
Good. Good. How was that right there when I got onto that spot?
That was exactly the spot. I felt the pain all the way through my shoulder blade. I couldn't literally even sit. But it was, yeah, you really felt the exact point.
I know you're ready.
I'm
Okay.
ready.
Here we go. We got a rock blade over here. And what we're going to do is we're going to take the rock blade. We're going to use it up to break some of these adhesions that form in some of the muscles. You can see. How's that right there?
Feels amazing.
All right. Good. And if you take a close look over here, you can see that the tool is breaking up some of the capillaries onto the skin, which is a good thing because it promotes healing when blood comes in there.
It's definitely more blood flow that I feel.
Yeah. Even the front of the neck, some of the muscles are very important to break up. If you've got tight neck muscles because you're sitting at a computer all day, you're going to want to have this done to break that up. You can see there's a little bit of redness over there. Okay. Why don't you move that around, just see if that feels a little looser.
Definitely.
All right. Good to
My favorite tool.
This one?
Yes.
All right.
Yeah.
Just a rock blade.
Yes.
Right there, you can feel that crunchy little nugget under there.
And that was exactly the side that I had pain in.
Yeah. And what I'm going to have you do is I'm going to have you open your shoulder blades. Good, right over here. I'm going to reach across. There you go. I'm going to have you really open up as much as you can there. There you go. Use the tool to break up some of these tight muscles.
Right there.
Yep. As you can see, you're getting a little bit of bleeding under there, which is a good thing because it promotes healing.
I don't mind as long as it heals.
I know you're tough. First time I met her was at Brazilian Jiu-Jitsu, and she was smoking everybody in the class. I was like, this girl's tough.
Blue basement.
The best place in the world.
Yes.
Right over there. You can see right over there, getting some good bleeding over there. There you go. Why don't you move that around, see how that feels?
Definitely better. Yeah, I don't feel anymore like super tight in here either.
Good.
Because it was connected all the way up.
Awesome.
Thank you.
You got it.
Do as many takes as you want.
Do as many takes as... Oh, so in other words, like, keep doing this.
Keep doing it.
It's funny how this works.
I think the camera malfunctioned.
Right, exactly. 3 visits in 1.
Exactly.
Getting some of your suboccipital muscles right there. You can feel how crunchy that is right there. Okay. Getting some bleeding in there, breaking up some of these adhesions to increase range of motion and decrease pain. Right there.
My right side.
We're decrunching.
Yep.
Why don't you move that around?
More blood flow.
Yeah.
Less crunch.
Nice.
Approved.
We're going to do some spinal decompression on Simona. Take some pressure off some of the discs, nerves, and joints. How's that right there? Alrighty. Spinal decompression is safe, it's gentle, and it's also proven to take pressure off of discs, joints, and nerves. So if you have a disc herniation, a disc bulge, degenerative joint disease, degenerative disc disease, a spondylolisthesis, how are we doing right there when I bring that down? All right. We're going to add a little component into here. Add some rotation in here. Good. How's that right there?
Exactly what my neck needs right now.
All right. Spinal decompression helps to increase range of motion by bringing the joints into their complete physiological range of motion. So if you have tightness in your neck, spinal decompression is safe, gentle, but more important, proven. How's that right there?
Heaven.
And how's that one right there?
Perfection. I really needed a stretch in my neck badly. Wow. My neck needed this. Thank you so much.
You got it.
You always fix everything.
Feels better, huh?
Yes, much better.
All right.
Thank you.
You got it.